It's a real privilege to be here in Wyoming, and I just want to really thank the tribal nations who welcomed us so warmly, the chairman from the Northern Arapaho and the chairman from the Eastern Tohono tribe. It's been an incredibly important discussion to really understand the governors and the tribal working together, as well as the community people of Wyoming. Right now, the Northern Plains states, I think you know, rank number 1, 2, 3, and 6 in the country per cases per 100,000. We can continue to see rising cases, rising test positivity, and rising hospitalizations throughout the Northern Plains states. We also see that in some of our Rocky Mountain states. We believe that is because part of many activities had been outdoors throughout early September, and there was a dramatic cold snap where people moved a lot of their outdoor activities indoors. We know now a lot about silent, asymptomatic, people who don't think they are infected with COVID but are, and are innocently passing viruses to others. And so we really talked about some details about the work of the amazing work here done by testing, both the tribal nation testing, but actually, Governor, your staff have done really a remarkable job weaving together very aggressive testing available to communities, finding asymptomatic individuals both in the tribal nations, but also doing wastewater testing. And I tell you, this combination of testing that has been done here is equivalent to anything that we have seen at the best universities. And I think this really shows the work that the state can do when they work in partnership, bringing together their health and science and data with the community together. And I just want to thank you, Governor, for your strong work there. We know that over these next ensuing weeks are going to be difficult, and we talked about how can we better support and bring additional testing to the state to really work with both the tribal nations and the community of people of Wyoming to really help communities come forward for those particularly under 40, under 35 that we know are most likely asymptomatic, and really figuring out how to do weekly regular testing. We have this new test. We have a series of antigen tests that are more widely available. We have about 3 times as many antigen tests as we have nucleic acid tests. We're doing about 1.2 million nucleic acid tests a day. We have the ability to do 2 to 3 million of the antigen tests per day over time as we move into November and December. And we really talked about how we could facilitate that additional testing. I think the work that's done here with saliva testing and wastewater testing and the creative approach to testing, the expansion in the public health laboratories, shows the level of commitment that the governor and his team have made to testing. And we heard that also from the Northern Arapaho tribal clinics. And I just want to applaud that work, but in addition, we as Americans need to continue to bridge to a vaccine and really do what we can over these ensuing weeks. We know what works. We know that wearing masks and physically distancing and washing our hands, and most critically, really understanding that when you have an event at your house or you go to an event somewhere, if it's outside of your household, there could be individuals there that are asymptomatic, do not know that they have the virus, and are spreading that virus. And if you and everyone there doesn't have their mask on, virus is spreading. And that's what we see is happening across the Northern Plains states. And so coming together as a community of Americans over the next 4 to 6 to 7 weeks is really critical. We see cases rising in county over county. The most rapid rising counties are Laramie, Albany, Natrona, Fremont, Campbell, Sheridan, Park, and Bighorn. But we have a third of most of all your counties in what we call the red zone. We see the slope of your increase in cases reaching a critical level, but we know how to stop it. And we're really calling on everyone in Wyoming, as we did in Montana, North Dakota, and South Dakota, to really come together, wear your mask, physically distance, but really pay attention to what you're doing in the household. in both public and private spaces, to not gather in that way that we know is spreading the virus, while we work on really bringing additional capacity here with these antigen tests to really ask every Wyomingite to come forward and get regular testing. And so we really want to work with both the tribal nations and the great governor and your superb epidemiologists and your state health officers to really put together a program that can really help us find what we call the silent spread, with people that really don't know they're infected and are spreading the virus to others. So really want to thank you, Governor, and thank the tribal nations and the chairman. Thank you for coming and talking to me. That dialogue and listening and learning has been critical. This is, I think, almost our 40th state that we've been in over the last 4 months, and we have learned a tremendous amount. I can tell you, when I go back, we will feature the governor on our next governor's call to really talk about what he's done with testing at the state level, bringing together innovation and science to create new tests and new approaches, along with wastewater and other testing. And we just want to be a partner in that and bring that together to really serve the people of this great state. And it's just been, we got to drive through your Wind River Canyon. It's beautiful. That physical beauty needs to be matched with our personal responsibility to each other. And we just really want to thank you for the reception, thank you for providing the space, and really thank you for the people of Wyoming that were really, it's really a call to action, a real call to action for us to change our behaviors over the next few weeks to really change the course of this pandemic, as they did with the southern surge that we saw in June and July and August when it got hot and people moved indoors to cool. So we know how to do this. We need to do it together. I can take a couple of questions.